Welcome back to Dolor Factor Live. Now we're just beginning to get into the meat of the subject, and while we wait to speak to Dr. Paris, I just want to repeat the question that we ended off with the last break, just before the last break. I don't know whether you can maybe, Dr. Gabriel, give us an example of how physicians, the ideal situation of how physicians work together when a patient enters the surgery.
Well, let me see if I can address that eventually. I mean, I think what you alluded to earlier on was why it is that one doctor may not be able to fully diagnose and treat a patient. Mm-hmm. And whilst I'm no pundit of the history of medicine, you understand that when in its early years, when medicine began, you know, wise men, philosophers were the ones who studied medicine and who gave recommendations for treatment. And we have people like Socrates and Galen and so on, and Hippocrates and so on. But as time has come on, and we've recognized that disease is not a simple matter, and we've been able to go in depth into it and identify the many facets of one illness, we've had the development of these specializations that we have now, surgery, oncology, gynecology. So one person may manifest in a particular way of signs and symptoms. And at the end of the day, you would find that in order to decipher which sign and symptom might predominate or might be the essence of the disease, you have to have specialists verify that this is the case or this is something to be ruled out. And, you know, a thorough assessment and review of the patient is required. And what people have to understand is that actually leads to a better understanding of their problem, and it will lead to a more accurate method of management of their problem. Because maybe before you may not be able to manage in a very precise way because you just look at it in a very superficial manner. So nowadays you require a number of specializations sometimes to work together to lead to a most adequate and most precise and fundamentally best practice evidence-based type of management.
Okay, so if we go back then to the question that I posed after that,
right, in
terms of the patient and the next steps, give us a scenario. If, say, I came into your surgery and you decided, or you said, okay, then I'm going to do a series of tests to find out what's wrong with you.
So for instance, it's a routine thing. A young person comes in with a breast lump, and they may be seen by their general practitioner. The general practitioner does a physical examination and identifies that this breast lump is of a particular nature, and they may say, well, you need to see a surgeon. The surgeon will then decide whether they need to just do a biopsy of that lump or go for an entire excision of the lump. And eventually, if cancer is discovered, then the person must be sent to an oncologist who will then administer the systemic treatment of that patient via chemotherapy or radiotherapy and so on. So it takes the spectrum of interventions are specific to the phases of management of that patient. And one person can't do it all.
Yeah, I understand that, and I'm sorry that I have to stop it there, but I do want to continue, and that's just because, as we promised earlier, we have Dr. Winston Paris on the line. I believe he's calling from North Carolina. I believe I'm correct, Dr. Paris? Can you hear us okay? Hello, Dr. Paris.
Hello.
Hello. Good night. Welcome to the Dolor Factor Live set all the way from the United States. Thank you for calling us. Is there a delay, I believe?
I could not hear you. I couldn't hear everything you said.
I just welcomed you. Thank you for being with us.
Oh, yes. Thank you. Thank you for having me.
Great. Now, we've started, unfortunately, I don't think you've been able to follow what we're saying. We're just talking about the importance of teamwork in the medical arena. And I know that you're originally from St. Lucia, correct?
Boy, we have a
very bad line. We have a bad line. Okay. can I just, okay, can you hear me all right now? Is it a bit better?
Yes, I can hear you a little better
Okay,
now.
great. All right. Let me just ask you then. I mean, what is your experience now that you've left St. Lucia, you're working abroad? What is your experience now? And what, in fact, maybe before I ask you that, tell our viewers what it is that you do. You didn't hear me.
Hello?
I asked, what is it that you do? What is your speciality?
Oh, I'm an anesthesiologist by specialty, but I have subspecialized into pain management. So I did anesthesia most of my well, for the first half of my career, and then I've now specialized into pain management. And now that I have retired from Duke University, I am sort of developing another career. It's that in addiction medicine. So I spend 2 days a week treating drug addicts in all walks of life. So my career has sort of evolved.
Okay, and it's something I suppose that I think most people when they're in the medical field, they enjoy what they do. But what concerns you most when we're dealing with teamwork in medicine? What concerns you most? Right.
Well, I'd like to answer this question by framing my answer by paying tribute and high honor to the late Owen King, who served St. Lucia with great distinction and great great distinction and excellence as a general surgeon, an obstetrician and gynecologist, as an orthopedic surgeon, as a neurosurgeon, as a cardiac surgeon, as a pediatric surgeon, as an ENT surgeon, and as an oncological surgeon from the late 1960s until his retirement in the 1990s. Owen did a fantastic job, and he did everything, and he did it with distinction. So I'd like to start by paying tribute to him. But we asked the question, is the Owen King model then relevant today? And the answer, it is not. Because in those days, there were no other specialties. And we were blessed with having somebody like Owen King who had tremendous diagnostic skills. We didn't have MRIs. We didn't have all those fancy things. And he did it all and got a good result. Today we have, medicine has become complex. There's a proliferation of knowledge. There are many specialties. For example, even in anesthesia today, we have neuroanesthesiologists, we have cardiac anesthesiologists, we have pediatric anesthesiologists, we have anesthesiologists that only specialize in pain. And, the amount of knowledge and data we have is so much that no one specialist could deal with it and still serve his patients well. So that's why I use Owen King as a model. It was fantastic what he did in his time, but it's not applicable today. And this brings into the concept of teamwork. As we to deal with all the knowledge that's available to us and to apply it to effectively to managing our patients, we have to have teamwork, we have to have collaboration, we have to refer to other colleagues who have knowledge in areas that we do not have, and we do all that while keeping patient confidentiality, respecting our colleagues, and keeping the high dignity of the profession. And for example, when I came to St. Lucia in 1971 as a young anesthetist, I did everything. I even delivered babies. I did mental health. I did everything. This is not appropriate today. In fact, it's dangerous today to have that model. So that with the age of specialization and the proliferation of medical knowledge, one has to share, one has to collaborate. And to do so and to serve patients, to me, that's a noble and dignified privilege. Now, that privilege carries awesome responsibilities. The responsibility for referring patients, collaborating, sharing data from X-rays and MRI, all so that we can better provide for the care of our patients. In other words, teamwork within the framework of professionalism, respect for colleagues, maintenance of patient confidentiality, and the maintenance of high ethical standards is what is required to comprehensively and completely care for our patients.
I mean, that's
anything short of that is going to be medically deficient, morally wanton, and probably legally vulnerable.
I think that's
I
fair.
think I should stop here.
That's fair for you to say, and also my guests on set. But to the patient, sometimes they don't understand it that way. They just don't understand it that way, because their level or their way of communication and taking in what you're saying is different to when you're speaking to your colleagues who understand. I don't know if you can hear me or understand what I'm trying to get at here. Okay.
I think I lost you a little bit.
Okay. Well, anyway,
we definitely do not have a good line.
No, we don't. We don't. But I'm going to have to say goodbye to you. I'm sorry we couldn't have a better dialogue. But thank you so much, because I think that it's now kind of opened up where we were going to get anyway. So, Dr. Paris, thank you so much for spending that short time with us. A very informative time.
Thank you so much for having me.
Thank you. Now, we're actually going to, I'm going to say to people now, I'm going to close the lines shortly, because we haven't even got round to trying to give you some of the answers to some of the questions that we had. I'm going to go into a break, and when I come back, we'll repeat the questions, and we'll kind of try to get into what we want to get into tonight. So this is a Dolor Factor Live, of course, on DBS. We'll be back with you quite soon.